The official death toll from the first 2 years of the coronavirus pandemic is about 5.4 million, but according to a new World Health Organization report, the actual number is around 3 times higher. The UN body said on Thursday there were 14.9 million excess deaths associated with COVID 19 by the end of 2021. Excess deaths are the number of deaths that occurred beyond the number expected in non pandemic years. One reason for the jump: deaths that were missed in countries without adequate reporting. Even pre pandemic, around 6 in 10 deaths around the world were not registered, according to the WHO. William Sambori is with the WHO's Department of Data and Analytics.
We do need better data. So one of the reasons why we focus on excess mortality is because we know the testing data is inconsistent across countries. And we know that there are many people who died before they were tested. So we do need death certificate data to ascertain uh, the cause of death attribution in more detail.
The report said almost half of the deaths not counted until now were in India, suggesting 4.7 million people died there as a result of the pandemic so far, well beyond India's count of less than 500,000. The WHO panel of international experts have been working on the data for months. They used national and local information as well as statistical models to estimate totals, a methodology that India has criticized. The new number also includes deaths indirectly related to COVID 19, such as those who could not access health care for other conditions when systems were overwhelmed during huge waves of infection. It also accounts for deaths averted during the pandemic, for example, because of the lower risk of traffic accidents during lockdowns. In a statement Thursday, the WHO called the data sobering and said that it highlights, quote, the need for all countries to invest in more resilient health systems that can sustain essential health services during crises.